Epilepsy is a brain disorder. Yeah, it's a disorder where a person keeps getting fits or seizures over and over again. And these fits are very small in duration. They last for about a minute or two, when the person may behave a little abnormally and then come back to normal. So when the person keeps having these kind of seizures over and over again, then we say the person has epilepsy. So seizures can come up in various ways, because as I said, seizure occurs when there is a little abnormal current in the brain. So depending on where that current is coming in the brain, the symptoms can be quite different, but usually they remain the same for a particular person. Now, the most dramatic type of seizure is what we call a grand mal seizure, in which the person falls to the ground, starts shaking all over, his eyes roll up, sometimes there is froth or saliva coming from the mouth, they may even bite their tongue. So this is a very dramatic kind of seizure that most people are aware of. But as I said, you'll be surprised to know there are various other kinds of smaller seizures where the person may or may not even lose consciousness. There are some where he may just become blank, stare, make some odd movements, and then come back to normal and may not be even aware. So these used to be called complex partial seizures. And there are others where the person is fully aware something is going wrong with them. So they may get just a jerking of the hand, or they may see some flashing lights, or just feel very scared for a little while and then recover. So when these happen in a stereotyped manner, they may actually be fits. It's not rare at all. Actually, as I said, fits or seizures happen sometime in the life of 1 out of 100 people. So if there are 100 people, out of that, one person may sometimes have a seizure or a fit in their life. But as I told you, epilepsy is not one seizure. We call it epilepsy only if it happens again and again. So out of 200 people in our population, one person would have seizures over and over again, and that gets called epilepsy. So 1 in 200 people have epilepsy. So it's not really rare at all. So I'm again mentioning how I told you how seizures can have various different symptoms. And this is the reason why it may sometimes not get diagnosed properly. And to complicate the matter, sometimes people behave very oddly for a few minutes, and it may actually not be epilepsy, because even with stress, people have certain odd behaviors. When blood doesn't reach the brain for a little while, what we call a fainting spell, that can also look like a seizure. So there are various other conditions that can also mimic seizures, and that is why diagnosing it can be quite a challenge. So the most concerning type of epileptic seizure is where someone loses control of himself and may even fall and hurt themselves, right? So that is what we call a grand mal seizure, and those are the ones that need attention. But the other side is that most of such seizures, they last only for a minute or minute and a half, and usually they stop on their own. So you don't have to do a lot to make the seizure stop. But of course, you have to take care that the person is not hurting themselves or injuring themselves during a seizure. So this is what we do for first aid of seizures. First, second, and third important thing is not to panic. Yeah. And what you can do, as you can see in this picture, is make the person lie down on one side and loosen their clothing so that they are not feeling suffocated, and make sure that the person is not hurting himself. So if there are glasses that the person is wearing, you may take the glasses off. If the tie is very tight, you can loosen it. And as I said, keep them on the side if there's saliva coming out of the mouth. So if they lie on their back, that saliva can go into the lungs and cause trouble. Sometimes they even vomit during a seizure. So you don't want all that going into their lungs, and that is why lying on any one side is very helpful. Don't force them down or hold them very hard on the ground. Gently hold them so that they don't hurt themselves, and watch the clock. As I said, usually minute and a half, the thing stops. So after they are fully awake, only then you should feed them anything. Drinking or eating is not allowed till the person is fully awake. Now, you also get a medicine in the form of a nasal spray. So if you talk to your doctor, they will recommend that spray. And if the seizure is going on beyond a minute, you can administer that spray in the nose. It's like puffs that we put in one nostril and the other nostril. So that can be done. No kind of, chappals and shoes and, all these kind of onions to be smelled, nothing to be done. It's not necessary, right? So if the thing doesn't stop despite you're doing all this, please move them to a hospital, and then the medical guidance will have to be sought at that time. As I told you, epilepsy is because of abnormal currents in the brain. Most of these abnormal currents are suppressed with medicines. So 70% of patients with epilepsy can be treated quite well with medicines. It is important that the diagnosis first be made right, the correct medicine has to be chosen, and once the doctor has prescribed you a medicine, it is extremely important that the medicines are taken very, very regularly. If you have trouble with the medicine, go back to your doctor and report what the problem is so that they can change it or adjust the dose for you. But do not miss doses. And the other thing to be very importantly taken care of is night sleep. The night sleep has to be regular and full. So these two things have to be followed very, very strictly. If we do this, as I said, 70% of people with epilepsy can be managed very well with medicines. It is true though that the medicines don't cure the epilepsy, and that is why medicines may have to be taken for longer periods of time. It could be 2 years, 5 years, or even longer, which your doctor will tell you. They may not be able to tell you the first day you go to see them, but over a period of time they will be able to guide you through it. So 70% of people get taken care with medicines. Now the remaining 30% may need other kinds of more specialized treatment, for which there are specialized centers everywhere now well available in India, and those can take care of even these patients whom medicines don't work. So as I said, most times people outgrow their problem over a few years, and then you just give medicines for that period, and then you may be able to kind of wean it off. But 30% of people, even after giving medicines, the seizures don't come under control very well. Now for these people, in few of them, we may be actually be able to offer brain surgery, which can potentially cure the epilepsy. So stop the seizures, and over a period of time, even the medicines can come down. So brain surgery is an option for few of the patients and not for all of them, which is what your doctor, that is an epileptologist or a neurologist, will be able to guide you whether maybe surgery is a good option for you or not. So as I told you, every person whom medicines are not working, we cannot directly go and do brain surgery. There are two principles that guide us whether a person can be given surgery as an option. For that, we have to ensure that these epileptic fits are coming from a discrete one area in the brain. And the second question we like to answer is this area safe to remove with surgery? Because if that's only one area is creating the abnormal currents, if we remove that area, then the rest of the brain can function normally. So this kind of finding out is done by a battery of tests. We call those set of tests a pre-surgical evaluation, and that includes a bunch of things. One is a very good quality MRI. Then we do something called a video EEG test. So this video EEG test is quite unique and interesting in that we admit the person, we put all the electrodes of the EEG on the head, we also put a video camera, and we deliberately reduce the medicines so that, and the patient is admitted in a hospital ward. The idea is let the seizures happen like they do at home, so that we can study those seizures. Which part of the brain is causing those seizures? So that is how we identify where in the brain the seizure is coming from. Once we know that, we do some other tests to make sure that area is not having any other vital function. So those could be a bunch of scans and other, nuclear scans and MRI, all of that will give us the information. And there's also sometimes we do a memory test or psychological tests. So we do a whole bunch of different things, and then a team sits together, all the people discuss among them the various findings, and as a team we make a decision whether the surgery is good for this patient or not, and then we discuss that with the patient, and then the patient undergoes the surgery.